Hey gang, Mark Sweeney here from beautiful Austin Dental Spa in beautiful Austin, Texas, and warming up Austin, Texas. Before we get too far along, if you've tuned into Wisdom Wednesday before, you know what this is all about. Every Wednesday around this time, we do a Facebook Live talking usually about dental topics, but not always. Always about whole body health and things that you can do. We always have a theme every month. The theme this month is grow yourself in May. And I don't mean around the middle like your waistline. We all did that back at the holidays. Now with summer coming, we're all working on those bikini bodies and summer bodies. So if you're wondering about the weird lips, I did not get a bad filler job, I promise. I ate at a new French restaurant last night over near the University of Texas. The food was really great, but the French onion soup had some stuff in it that I have not tasted in French onion soup before. And one of those ingredients, the only other time this has happened is when I eat hot and sour soup from some Chinese restaurants. Not all of them, because I love hot and sour soup, but something that they put in some of the French onion soups and hot and sour soups gives an allergic reaction. I woke up about 2 a.m. with my lower lip swollen, and then by the end of the day today, my upper lip is swollen. So now I know it's an allergic reaction. I thought maybe I'd bitten myself during my sleep last night. So try to ignore it like I've tried to all day. I don't really notice it until I try to drink through a straw or sip hot coffee. This morning was a little challenging. But anyway, today it's not going to lessen the topic that we have. We're talking about growing yourself. Well, we're going to link brain health and whole body health with oral health, with what goes on in your mouth. Now, 40 years ago in dental school, they told us our knowledge stopped right here, that everything we were going to learn in the next 4 years stayed above the collar line, that we didn't need to worry too much. We kind of took a whiz through the rest of the body in anatomy and then came right back to the head and neck area. Well, we know 40 years later, that's far from the case. Things that go on in the mouth do affect the rest of the body and vice versa. And we've talked about that many times on Wisdom Wednesdays about the oral systemic connection, oral being the mouth and systemic being all the other moving parts of the body and how they all interrelate. We've also talked in past about the link between one particular type of bacteria out of about 30 that can cause gum disease in the mouth, and the only other place in the body that they find it is in Alzheimer's patients, of course, after they're deceased and they've donated their brains to science. Scientists over the last 20 years have found one spot in the back left part of the brain that has a plaque buildup, that the only other place they find that porphyromonas gingivalis is in the mouth of people with gum disease. So there is definitely a link. They can't quite get to cause and effect. They're still trying to figure out, how does it get to the brain? Does it go through the bloodstream, or does it climb through the nerves? Because it can do that. But in any case, in the next 20 years, they'll figure it out. But for the time being, we're going to talk about a couple of different studies, one in Japan and very out of the ordinary, one from Korea, that help cement that relationship between the brain and your oral health. At a university in Japan, this study actually just came out in July of last year, July 2023. They only had 172 people in this study. The average age of the people in the study was 67, so they trended towards people over the age of 60. They did dental exams on all of these people, and they did brain scans on all of them, and then they tracked them over time, and they found that people who had missing teeth or had gum disease, bleeding gums, bone loss around their teeth, also had different brain scans and shrinking brain, particularly in the hippocampus area, which is part of the midbrain, that has to do with emotions and memory and unimportant stuff like that. So after they adjusted for other variables, they found that the rate of brain shrinkage roughly was similar to if for every one tooth you were missing, it counted for 1 year of brain shrinkage as you're aging. So missing a tooth potentially shortens your life expectancy. Certainly your mental function capacity. So I found that very interesting. They also kind of flipped it and did it in reverse. People that had healthy mouths had longer life expectancy, and they found a correlation there between the people who were going to the dentist regularly and had healthy mouths, had healthier brains with less shrinkage and less aging related illnesses. So now, what does that have to do with anything? We've known for years that people with problems with their oral health also have problems with their heart. It's not a direct cause and effect that if you've got gum disease, you're going to have heart problems, but there is definitely closer to a cause and effect. It doesn't work the other way, that if you have heart problems, you're more likely to have gum disease. They have actually tested for that, but people with unhealthy mouths tend to have more likely to have heart problems. So what they think is, and my older brother's a heart surgeon, I used to sit at Thanksgiving with him every year and say, hey, what if the bacteria that are causing the plaque that you deal with in people's arteries is the same stuff as the bacteria that cause the sticky stuff around teeth that I deal with all day long? And he went, you're just a dentist, you don't know what you're talking about. Well, 20 years later, I was able to get the last laugh on that, because they have found direct correlations between the plaque in arteries that builds up and can cause heart attacks and blood clots, and the bacteria in the body. Because when you chew, if you've got gum disease to a point where your gums are bleeding and swollen, when you chew, it disrupts those bacterial colonies. You're going to swallow some of that blood, you're going to swallow some of that bacteria, and some of it passes through your stomach and gets into your intestines and gets absorbed into your bloodstream. Hate to be so graphic about it, but it actually does happen. So we have seen that in our own patients, and so that's why we're such Nazis about coming in regular, getting your teeth clean, and keeping bleeding to a minimum in your mouth. So this next study, I found it very interesting. It was in Korea, the Korean National Health Insurance System. Hate to bring insurance into this, but they took people aged 40 to 79, almost a 40-year span, with no history of atrial fibrillation or heart failure. And they collected height, weight, they did lab tests for blood disorders, they did lifestyle exams, they did check their oral health and their oral hygiene behaviors, and then they did a study on them for 10.5 years. Now these are people that at the youngest are 40, and they followed them for 10 years. At the oldest, they were almost 80. So the people that had developed heart problems, or the people that had gum problems, almost 5% of them developed atrial fibrillation, and after 10 years they found that there was a 10% increase in overall heart problems. And on the contrary, like the other study, they found that people who brush their teeth more than 3 times a day, or I think their minimum was 3 times a day, people who brush their teeth 3 times a day or more, that was associated with a 10% lower risk of heart disease. So why take the risk? A 10 to 12% increase in heart problems if you're not taking care of your teeth, and a 10% decrease if you are taking care of your teeth. So, my health tip for the week, that's an easy segue. Take better care of yourself. If you haven't been to a dentist in a while, we saw 2 people just this week, and it's only Wednesday. So in the last 3 days, I've seen 2 people that had not seen a dentist since before COVID, and they were definitely overdue. That's 5 years now, because it started in 2020. These people were 2018, one of them, and 2019, the other one, and it's 2024 now, gang. So it had been a while since they'd seen a dentist, and we could see. One of these had been a patient of mine before, the other was a new patient, and we could see. I knew what his mouth used to look like in 2018 when he was coming regularly, and he just got kind of freaked out about the virus and all the stuff going on and mask wearing, and so he just quit coming. And we're catching up. We're making up for lost time and getting the bleeding under control by seeing him a couple of more times. But it does happen. So take care of yourself. If you see bleeding on your toothbrush, or if you know what dental floss is and you're using that string between your teeth and it turns pink, you probably need to see your dentist, or come see us. We'll be happy to take care of you. My lips should be not swollen anymore by then. I promise I did not have fillers. And so I will see you next week for another version of Wisdom Wednesday with a normal lip, and maybe the K team will join me next week. Thanks for tuning in, and I'll see you next week.